Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The widespread impact of coronavirus tonight on Behind the Headlines. I'm Eric Barnes with the Daily Memphian. Obviously, we have shifted from doing the show in the studio at WKNO, and we are doing the show remotely. So thank you for joining us, and bear with us as we do this first show remotely. But first, let me introduce our first guest, Paul Young, Director of Housing and Community Development for the City of Memphis. Paul, thanks for joining us.
Thank you for having me.
Along with Bill Dries, reporter with the Daily Memphian. Thanks for being here, Bill. We will get started here, Paul. First, how are you? I should start every conversation with how are you doing? How's your family? And you obviously are sheltering and social distancing.
Yes, we are. Our whole staff is doing that. I'm doing well. It's very busy, even though we're working from home. We have a lot of needs that we're working to coordinate on behalf of the citizens of the city. And so while it's a trying time, I am very optimistic that we are going to come out on a positive end.
Yeah. Well, and so there are roughly 13,000 people in Memphis public housing. Is that a fair number?
Roughly. I think there's closer to 8,000 that technically have vouchers, and probably another 1,000 or so that are currently housed in the towers and senior buildings and things of that nature. And then there are another 8,000 residents that are on the waiting list for vouchers.
Right. Well, you very nicely corrected me that my number was completely wrong. So but thank you. I do appreciate that. I blame it on the remote location. What are you all doing? I mean, maybe take it. You've got a lot of, I mean, just by definition, folks in public housing are lower income. They may not have as good access to healthcare. They may have food insecurity. I mean, how all the kind of spiraling issues that go with this, let alone the social distancing. How are you tackling those issues from social distancing to food insecurity to healthcare?
So I want to first give the caveat that Marsha Lewis, my colleague, who is the executive director of Memphis Housing Authority, she's doing a great job. So all the things that I'm going to say are things that I've heard from her or things that we talk about on our calls. But the things that I know they're doing is they have started a new program where they're allowing the housing authority residents to start doing some working remote. They're looking at alternatives for adding Wi-Fi for the individuals and families that live there that may need to be connected to schools. They're also training the residents on how to do the social distancing, making sure that all of those policies are followed. For some of the towers, they have limited visitation, particularly the senior buildings, because obviously we know what impact it can have if the virus infiltrates those communities. And so everybody's just being as cautious as possible. In my division with Housing and Community Development, we've been spending a lot of time primarily focused on the homeless population because we want to ensure that those individuals and families have places to shelter. In this time where we're asking everybody to quarantine and be isolated, some of those individuals don't have that opportunity. And so what we've done as a city and county, we've collaborated and we've identified 2 hotels where we now have about 112 rooms reserved for individuals and families. We have about 36 for families. We have about 50 for homeless men. So we had about 100 men move in yesterday, which was on Wednesday. And we have about 26 units for single women. And so what we're trying to do is make sure we're doing our part to keep these individuals and families safe during this time.
You touched on so many things, and I should know we're taping this on Thursday morning, so that's when Paul references Wednesday. Just the simple thing of internet access, a thing that many of us are guilty of taking for granted. You've got people, I was about to ask you, dumbly, where do people go on the internet to find out the resources that you all offer? Of Of course, not a lot of people have that. And then you've got a lot of kids at home, I'm sure, who are trying to do some online classwork. And so how do you tackle that?
It's a big issue, and it's one where, what we've tried to do is try to bring as many resources as quickly as possible. But I think that this virus is exposing some of the issues that have been lingering for a while. We've always had issues with internet connectivity, but this virus has caused us to have an emergent need where kids are trying to learn remotely. And if they don't have the resources in their home, what do? The libraries are closed, all for good reason, given the time that we're experiencing. But I think on the other side of this virus, we have to identify ways to address the digital divide. We have to figure out ways to improve our system of referral for homelessness. This is something that I myself have gotten much closer to in terms of the issues that we have. For instance, we have a great referral process for families. For individuals is not as strong. And so on the other side of this process, we want to make sure that we strengthen that pipeline so that any person that is in need of housing has an opportunity to be able to access.
Let me go to Bill Dries and get him in the mix here. Bill.
So Paul, we've heard that on a number of fronts. The whole thing about this pandemic highlighting some existing issues that are still going to be here after this runs its course, whatever it is. So are you looking at the Wi-Fi access as an example? Are you looking at that as not only temporary, but a permanent move in public housing?
Absolutely. I mean, we are absolutely looking at how we're going to contribute to ensuring that these families are connected. In my department, oftentimes we work with developers and groups that are trying to build housing units. But I believe that if we don't think about the individuals and families that are going to occupy those housing units, then our community won't be much better. And so we have to think about what are going to be the things that allow people to thrive as they move into these communities that we are working to fund. And internet connectivity is something that is at the top of the list, particularly during this time. It's really shined a light on that need.
And I believe that as of Friday, the city is going to have a call center. I heard the mayor talk about this on the at the Wednesday briefing. A call center that uses tourism industry people who may have been laid off, as well as restaurant workers who may have been laid off, to basically call residents and say, "Hey, how are you doing?" Pass on tips about social distancing, that kind of thing. Correct?
Yeah, absolutely. I think that's a fantastic program that the mayor's communications team and the tourism industry, as well as the Memphis Housing Authority, have coordinated. During this time, you have so many emotions and feelings, and those of us with large families, we have people to talk to and express those feelings. But many of our seniors that are isolated in housing units by themselves, they don't have that luxury of having people to talk to. They don't have the luxury of having people to call and check in on them. So I think this is a great opportunity, and this an example of our community coming together to make sure that we're doing what's best for our residents.
So you mentioned working with developers, and so much of HCD's work is working to leverage public investment with private investment as well. What is the status of that in this pandemic?
Right now, the development community is still active on those projects that were already ongoing, particularly those that were led by the city. So things like Raleigh Springs, we're still doing construction on projects like that. Our community development partners, they're still completing the housing units that they were working on, but they are ensuring that their contractors are using all of the safety precautions that are necessary during this time. But I think a lot is still yet to be determined. We don't know what the full fallout will be from this issue. And so I think over the next weeks and months, we will know a lot more about how our development community is responding.
At this early stage in terms of financing, have any of the private partners in these various endeavors, have they expressed any reservations about what their commitment looks like now as opposed to what it looked like before this?
Not yet. We haven't heard any reluctance yet, but obviously we know that things are changing on a daily basis. It's still yet to be seen. But I think that we are, as a community, are taking an aggressive approach to this response. Every morning there's a joint task force call that the city and county and municipalities from the surrounding area are on each day with the hospital systems, with different leaders from throughout this community. And we're all working to make sure that our response is coordinated so that as we come on this other side of this issue, we can see some light at the end of that tunnel. And I believe the development community is still kind of standing by and waiting to see what happens.
All right, and I will throw it back to Eric. Sorry for the crew term there, but we're working with what we have here. So back to Eric.
Yeah, absolutely. Thank you, Bill. Paul, you mentioned, getting to the other side of this. Do you have, as a division or as the city government, is there an operating assumption at this point of when we will be on the other side? Is it weeks? Is it months? Is it the fall?
I definitely couldn't give you an answer to when we will be on the other side. All of the health professionals say we're still a couple of weeks away from our peak. And our hope is that all of our social distancing measures and things that we're doing will blunt the peak of that curve. And so we don't know when it'll end, but we know that at some point it will, and we want to make sure that we're prepared to respond. We think that there'll be obviously some impacts to municipal budgets. You'll see property taxes will be a little bit lower. You'll see some reductions in sales taxes, and so we're going to make sure that we are as responsive as we can to the needs of our residents and still providing those critical services.
Are you on that budget issue? Are you already sort of doing scenarios? A lot of businesses are, obviously a lot of nonprofit organizations. I assume to some degree you're sort of planning for various scenarios of fall off in revenue.
Yeah, so from a city government perspective, we've been working on our individual budgets as divisions and as a broader city government over the last couple of months. And obviously the last couple of weeks, we're starting to take some revised looks at our budget.
Right.
The mayor's going to be presenting that to city council on April 21st. He's kicking off the budget hearings. I expect that it'll be a lot of back and forth over the budget this year, trying to figure out how we can make sure that we're filling voids and trying to make the best projections that we can, because obviously our budgets are based on a projection of what revenue will look like. And we still don't know how hard this crisis will hit us.
And I have lost track that actually it's the normal budget season. This is the typical time where we're going into budget seasons anyway. One thing, I have so many questions, but on things we've touched on, but one about social distancing. Have you seen or have your folks who are out there seen that within the communities you manage or oversee, that social distancing is being honored? Is it being, are the rules being followed?
I've heard different perspectives on whether the rules are being followed. I think early on that they weren't being followed as strongly. The further we're getting into this crisis, I think you're starting to see an increase in the social distancing. You've seen a number of studies. I think one came out a week or so ago from the state, and they said as a city, we had roughly 46% social distancing. Nashville was somewhere around 55%, and they were using mobile phone data to determine how that social distancing was going. What I've heard this week is that we're doing better than we were, but I don't recall what that percentage is. And in our respective neighborhoods, I think we just have to ensure that we don't let our foot off the gas. I think we're going to start seeing some bright signs. We're already hearing that the curve may be flattening a little bit, but we should not let good news prevent us from continuing to stay the course, because we have to ensure that we completely blunt the impact of this virus.
What about access to healthcare for the folks in your neighborhoods? Are you able to get them to some of the either the hospitals or the community clinics? Are you offering transport, or
Yeah.
are you trying to tackle that in any way, or is that just beyond the scope of what you can do?
Absolutely. I mean, that is a very important issue that you're touching on, because we have some clinics that are established, particularly around testing. Christ Community has been a great partner, as well as many other systems throughout the healthcare system throughout the community. They've established drive-up locations, but many of our residents aren't able to drive. So we're working with Christ Community, Memphis Health Center, Church Health Center, and other partners to try to identify a mobile solution where you can actually bring some of the testing to the particular locations, particularly where we have large concentrations of low income residents and families that don't have transportation. We're also looking at bringing that type of testing and screening for the areas where we have large concentrations of homeless populations. And so we're trying to do everything we can to work with as many resources as possible to ensure that we are bringing healthcare to those families.
Yeah, you mentioned the homeless, and to the degree I've been out going to the grocery store or whatever, I at one point drove by a shelter, and it's heartbreaking because you've got tremendous amount of mental illness, a lot of in a pretty desperate sort of situation, and there was not a lot of social distancing going on as homeless folks were it was clearly a time when there was a meal being served.
Right.
That has got to be a challenge. I mean, it's a challenge for the social distancing is a challenge to some degree for everyone. But if you're talking about a mentally ill person who's not really understanding what's going on,
right,
probably hasn't had good health care for some time. I mean, it's a sad and really difficult challenge.
Yeah, it's a very difficult challenge. And, when we first got into this crisis a couple of weeks ago, we had one of the shelters that housed roughly 30 or so women shut down. And so we immediately worked with the Hospitality Hub to have those women housed in a hotel. We also realized that we needed more capacity for families. MIFA, who's already been a great partner, and they man our homeless hotline, which is a hotline where you can call if you're a family that's experiencing homelessness, and they help navigate you to various resources for housing. Their resources were stretched, so we added 36 additional hotel rooms for those families. And as I mentioned just yesterday, we have been working with Memphis Union Mission over the last week. The Memphis Union Mission houses 350 men per night. They walk up off the streets and they're able to have a place to lay their head. Obviously, with 350 people being the capacity, there wasn't a lot of social distancing possible. So in order to allow them to have the men, give the men the ability to spread out a little bit, we've added an additional 50 rooms where we've taken 100 of those men, and we now have them in hotel rooms.
Are you able, before I go back to Bill, are you able to provide anyone dealing with the public with enough, gloves, masks, protective equipment? Are you able to get those supplies, or has that been a challenge?
It's been a challenge, but it's been a challenge for everybody. So we're working within the city and county resources to bring in a large shipment of supplies, which should be here any day now. We'll be using those to distribute to the clients and the service providers. One thing that I also did not mention is that as we have these clients in these hotel rooms, we are working to bring social services to them. So we have caseworkers and managers that are working with them to ensure that over the next 30 days, we can be working with them so that they can find permanent housing.
Yeah, and I should say, as we get ready to go back to Bill, I had Sutton Moore Hayes from the Community Foundation of Greater Memphis, which has started a fund to raise money to help some of these. I think they're working with you all. They're working with a lot of groups in town. And they mentioned trying to leverage the city's resources to buy the protective equipment for various divisions and small nonprofits. I assume that's a part of what you're talking about here. And so tremendous work that they are doing. Let me go back to Bill Dries.
Paul, obviously when this is over, the hotels where these folks are staying go back to the business that they were built for. Are there any elements of this strategy for caring for the homeless during this pandemic that have kind of made you stop and think, well, maybe there are some adaptations that can be used after this is over?
Yeah, well, we definitely hadn't thought about using the hotels long term. We always use the hotels for short term stays. We hadn't really used them for 30-day extended stays as we are right now, and we hadn't been really thinking about that as a part of our long term strategy. But we have been thinking about how do we improve the referral system altogether. Right now, we do a great job of passing on referrals for families. I think we can do a better job. And when I say we, I mean me and our division in housing and community development. I think we can do a better job of ensuring that individuals are also able to have a short, distinct number to call to be placed for housing in emergency situations. We're also looking at facilities throughout the city, some of which are almost complete, and trying to think about how they may be able to serve the homeless population. One example I would say is Collins Chapel. That's one, a rehabilitation center on Ayers that's almost completed, 28 bedrooms. If that facility was ready today, we would have had a place where we could refer these individuals. And when I talk about homelessness, we should think about it in two phases, because what we're working on now, we're trying to house homeless individuals and families that are non-COVID-19 positive. And then we're also working with the health department in Shelby County to try to identify housing for COVID-19 positive individuals that are mandated by the health department to shelter in place, and they may not have anywhere to go. And so we are also trying to think about what places can we do that. Thankfully, we hadn't had that issue yet, but we do believe that might be an issue in the future. So we're working on a lot of fronts to ensure we're covering all the bases.
With just a few minutes left, your budget during the budget season historically is one of the quickest reviews by the council because the majority of your funding is federal funding. Does your federal funding take a hit as the federal government has the stimulus bills, or is the federal money new money in addition to what you get for the various HCD programs? Yeah,
right now the federal dollars that are coming in, those are new dollars to our budget. We have not heard or seen that there will be a hit on the federal budget side, at least not yet. But all of these expenditures that we're making right now for emergency housing and all those things, we will be able to reimburse ourselves for some of those costs. And so the thing we have to consider is how much we're spending right now that'll come out of any of those future dollars that do come down from the federal government.
All right, Eric, back to you.
Yeah, let me follow up a little bit, Paul. You mentioned with the stimulus, so far $2 trillion stimulus package that the federal government has passed. Are there specific, everyone's still kind of trying to figure out what's in there, small business loans and individuals and so on. Is there money specifically for homelessness and for public housing that's above and beyond?
Yes, I don't know the specific dollars that are allocated for public housing. I know that there are some that we'll be able to use for maintenance of those facilities, but dollars that I know will be coming through housing and community development. There will be some additional community development block grant funding, roughly $4 million there. We will have some additional emergency solutions grant, which is essentially for homelessness. That'll be roughly $2 million. And then there's another $1 million for housing opportunities for persons with AIDS. And so those additional resources will be able to help offset some of the expenses that we're making right now. And we will also be able to explore other opportunities to invest those dollars to help our community.
I'm curious, it may not be one answer to this, but with all the issues and populations you're dealing with, what is your biggest need right now? if you could wave a magic wand and get one thing fixed, obviously other than getting rid of the virus, I mean, what is the biggest need among all these needs?
I mean, housing is probably the big answer. All of these individuals and families, they need places to shelter in place. And you mentioned it earlier in the interview, when you drive by and you still see people that are still sleeping on the streets for whatever reason. And we just can't get enough resources to occupy all of the spaces that are needed, or to cover all of the people that are needed. So I think that's probably the biggest bucket, but once you drill down, you start getting into the transportation, the technology. So there are just so many issues that I'm thinking about on a daily basis from the seat in which I sit. But there's a coalition of people that are thinking about it from an even broader perspective, particularly around healthcare and all of the needs that we have.
All right. Well, I think we're going to go ahead and wrap it up as we move forward here. Thank you, Paul, for joining us. And thank you, Bill, for participating in this. Thank you all for joining us. We will be doing this for the indefinite future. So we'll see how it goes, but we appreciate you being here and see us come back and watch us again next week. Thanks.